Baby not making eye contact. Should parents worry? As a new parent, you naturally watch every little thing your baby does, looking for signs of healthy development. One concern that often comes up is when a baby does not seem to make eye contact. This can feel worrying, especially with all the information available about developmental milestones. The good news is that in most cases, limited eye contact in babies is completely normal and not a cause for alarm. However, understanding what is typical and what might need attention can help you feel more confident as a parent. Understanding. Normal eye contact development. Newborn babies have very limited vision. In the first few weeks of life, they can only see clearly about 8 to 12 inches in front of their face, which happens to be roughly the distance to your face when you hold them. During this early stage, babies are still learning to focus their eyes and process what they see. Their eye contact may seem brief or inconsistent, and this is entirely expected. Around 6 to 8 weeks of age, many babies begin to make more deliberate eye contact and may even offer their first social smiles. However, every baby develops at their own pace. Some babies are naturally more visually engaged, while others may be more interested in sounds or touch. By 3 months, most babies will track faces with their eyes and hold your gaze for longer periods, especially during feeding or playtime. Between 4 and 6 months, eye contact typically becomes much more consistent. Babies at this age often light up when they see familiar faces and will actively seek out eye contact with their caregivers. They might stare intently at you during conversations or while playing. This is a wonderful sign of social and emotional development. Why some babies make less eye contact. There are many innocent reasons why your baby might not be making as much eye contact as you expect. Personality plays a significant role. Some babies are naturally more reserved or take longer to warm up to social interaction. Just like adults have different comfort levels with eye contact, babies have individual temperaments too. Your baby might also be distracted by their environment. Babies are constantly learning about the world around them, and sometimes a ceiling fan, a shadow on the wall, or a toy is simply more interesting in that moment than your face. This is normal curiosity, not a red flag. Tiredness, hunger, or overstimulation can also affect how much a baby engages visually. When babies are uncomfortable or overwhelmed, they often look away as a way to self-regulate. This is actually a healthy coping mechanism. Additionally, some babies need more time to process visual information, so they might look away briefly before returning their gaze to you. When to pay closer attention. While most variations in eye contact are normal, there are some situations where you might want to discuss your concerns with your pediatrician. If your baby consistently avoids eye contact by 2 to 3 months of age and shows no improvement over time, this could be worth mentioning during a checkup. Keep in mind that one isolated behavior is rarely a concern, but patterns matter. Other developmental signs to observe include whether your baby responds to sounds, smiles socially, shows interest in faces, and engages with caregivers in other ways. Healthy development involves many different skills working together. A baby who makes limited eye contact but responds to your voice, smiles, and interacts with you is likely developing just fine. Around 9 to 12 months, babies should be showing interest in people, responding to their names, and using gestures like pointing or waving. If your baby is not doing these things in addition to limited eye contact, it is reasonable to have a conversation with your healthcare provider. They can assess whether your baby would benefit from early intervention services or if this is simply part of their unique developmental timeline. How to encourage eye contact. There are gentle, natural ways to encourage eye contact without pressuring your baby. The most important thing is to make face-to-face interaction enjoyable and rewarding. Talk to your baby during daily routines like diaper changes, feeding, and bath time. Position yourself so your face is in their line of sight, and speak in a warm, engaging tone. Playing simple games can also help. Peekaboo is wonderful for encouraging babies to look at faces and anticipate social interaction. Singing songs with hand motions, making funny faces, and using animated expressions can capture your baby's attention and make eye contact feel natural and fun. Reduce distractions during interaction time. Turn off the television, put away your phone, and create calm moments where your baby can focus on connecting with you. Babies are more likely to make eye contact when they are not competing with other stimuli for their attention. Respond enthusiastically when your baby does make eye contact. Smile, talk to them, or make a gentle sound. This positive reinforcement helps your baby learn that looking at faces is rewarding and leads to enjoyable social exchanges. Cultural considerations. It is also worth noting that cultural practices around eye contact vary significantly. In some cultures, prolonged eye contact is encouraged and seen as a sign of respect and engagement. In others, direct eye contact may be considered rude or overly assertive. Your own cultural background and practices may influence how you interact with your baby and how your baby learns to use eye contact. Trusting your instincts. As a parent, you know your baby better than anyone else. If something feels off, or if you have persistent concerns about your baby's development, trust those instincts. It is always appropriate to discuss developmental questions with your pediatrician. They can provide guidance, conduct developmental screenings, and refer you to specialists if needed. Remember that early intervention, when necessary, can make a tremendous difference. But in the vast majority of cases, babies who make limited eye contact in the early months go on to develop completely typical social and communication skills. Every baby is unique, and developmental timelines can vary widely while still falling within the normal range. Give yourself grace during this journey. Parenting comes with so many questions and uncertainties, and worrying about your baby's development is a sign of how much you care. Stay connected with your healthcare providers. Observe your baby's overall development rather than focusing on single behaviors. And enjoy the beautiful process of watching your little one grow and learn to connect with the world around them.